students, today we are going to be conducting a comprehensive neuro examination. We will start with the mental status of the patient, work our way through the cranial nerves, and then assess the motor and the sensory systems. When assessing the patient, as soon as you walk in the room, you're going to note their general appearance and their behavior, as well as their cognition, mood, and affect. During the exam, when the patient is answering your questions, you're also going to want to be assessing the patient's speech to determine if it's gargled, is it slowed, is it appropriate, is there delays, kind of to keep an eye out for those things. All right, so we're going to begin our exam. Can you tell me your name?
Kelly,
Okay, can you tell me today's date?
August 11th, 2020.
2020, good. And can you tell me who the president is?
Donald Trump.
Donald Trump. Okay, sometimes when patients are in the hospitals for a couple of days, they lose track of what the day is or the date, so that's not unusual. But getting the month and the year or even the season would be appropriate. All right, cranial nerves. Kelly, I'm going to go ahead. We are going to check olfactory, which is number 1. I'm going to have you close your eyes. Okay. Go ahead and include your left nostril. Just put your finger on it. Okay. Tell me, what do you smell?
Coffee.
Good. Now, keeping your eyes closed, include your right nostril. Tell me what you smell.
Coffee.
Good. With testing the olfactory nerve, we're just making sure that the patient is able to identify a pleasant smell, preferably something like coffee, symmetrically. If they do not, we need to identify that. All right, next we are going to be checking the optic nerve, which is number 2, and we are going to be checking the visual field in our periphery. When you're checking the optic nerve, you're checking visual fields as well as visual acuity. However, the visual acuity of a patient is shown by the Snellen chart, which we will not conduct today, and is typically not done in-house. However, if you are concerned about that aspect of the patient's optic nerve function, you could use a newspaper. Okay, Kelly, I'm just going to have you cover your left eye, and then I'm going to cover my right eye. And when we check this, I'm checking her periphery, and the reason why I'm covering my eye is that I'm ensuring that when I hold up the number of my fingers, I can see them, and that means that she should be able to see them. That way I'm not holding them outside her field of vision and then marking it as incorrect or negative part of that assessment. So that is why I'm covering up my eye. Okay, Kelly, I'm going to hold up my fingers in your peripheral vision, and you're going to tell me how many you see, but only be staring at my nose. Okay? Ready?
2.
Good.
1.
Good. 3. Good. All right, now, go ahead and take your hand off and cover up your other eye. All right, ready? Same thing.
1.
Good.
2.
Good.
3.
Good. Perfect. So we have just checked her optic nerve. Now, in cranial nerves 3, 4, and 6, they are tested together, and we are looking at the oculomotor, the trochlear, and the abducens. We're going to have a patient follow our pen light through the 6 cardinal fields of vision. When they do that, they need to just be following with their eyes, okay? So 6 cardinal fields of vision are often thought of as an H formation. All right, Kelly, are you ready?
Yes.
So you are just going to be following me with your eyes. You're not going to turn your head, okay?
Okay.
All right. Perfect. So if the patient is able to follow, then that would be positive part of the assessment. The next thing we're going to do is the Perla exam, which you have all known in your head to toe assessment. The best way to do this is to dim the lights, which we're not able to do in this room, and then that forces the patient's eyes to start to dilate. So once they start to dilate, then we turn our pen light on. And when we are looking at the patient's eyes, we're noting that the pupils are symmetrical, and we're noting the size. And then we take our pen light off from the side and watch the pupil constrict. Okay? Good. All right, once that part of the assessment is done, then you're going to turn the lights back up, and now we're going to check the patient's accommodation. So the lights are turned back up, and we're going to have her stare off into something behind me, okay? And then I want her to fix her eyes on my pen. All right, and then you take the pen and you go to the tip of the patient's nose. Just follow my pen. Good. This shows that her eyes are able to accommodate and not be showing nystagmus, which is the flickering of the eyes. So that is what we are looking for. So you would say that her pupils are equal and active and reactive to light and accommodation. All right, now we're going to attack trigeminal nerve number 5. So we're going to have you clench your teeth. Perfect. All right, when you clench your teeth, I want you to close your mouth and just clench real tight. And I'm just going to kind of feel her muscles here. Good. And then I'm going to feel up here, clench real tight. What I'm feeling for, you can relax, is to make sure that her muscles are symmetrical and moving together. So that is trigeminal nerve number 5. That is responsible for mastication, so our chewing. Number 6, remember we checked 3, 4, and 6 together, so we're going to move on to number 7. And this is where we're going to have her close her eyes real tight and then open up. Now close real tight again and open up. Now smile and frown. Good. So what we are doing is checking again, looking for symmetry and smooth muscle movement. Number 8, we are going to be checking her vestibulocochlear cranial nerve, and this is often tested when the patient reports dizziness. So what I need her to do is I need you to close your eyes, and then I want you to close your left ear. So take your finger and just close your ear. Good. All right, I'm going to whisper 2 words, and you see if you can hear them. Can you hear that? What did I say? Happy day? Happy day. Happy day. Okay, now I want you to go ahead and close your other ear. Close your eyes. Wednesday. What did I say?
Wednesday.
Wednesday. Good. All right, so that's just testing that that nerve is up and running properly. The next one we're going to check is our glossopharyngeal, and this is what we need a tongue depressor for. This is often seen physicians doing in doctors' offices. I'll try not to stimulate her gag reflex too much, but what we want to make sure that we're doing is watching the uvula move up and down the way it should when she says ah. All right, go ahead and open wide. Say ah.
Ah.
Good. And at that moment, then you would also kind of just tickle that gag reflex to make sure that that was working properly. All right. Number 10 is the vagus nerve, and we're not going to test that separately. That's done throughout the exam. As you listen to the patient talk and answer and converse with you, we're making sure that the voice isn't hoarse. That is checking the vagus nerve. All right, now we're going to check your accessory nerve, which is cranial nerve number 11. I'm going to have you move your head side to side and shrug your shoulders against resistance. Okay?
Okay.
All right, so shrug your shoulders. Good. Move your head against my hand. Good. Good. She should be able to move my hands, and she should be able to move her muscles symmetrically. All right. And now I want you to stick out your tongue at me. We're checking your hypoglossal cranial nerve, which is cranial nerve number 12. And I want you to stick it out again. I want to see that it's symmetrical. Now move it side to side. Good. We're noticing symmetry in her tongue, and we're noticing that it's not does not have any atrophy. Okay, we are down to the last 2 systems. We have our motor system and then our sensory system. In the motor system, this is often done in your head-to-toe assessment, and you're going to notice that a lot of the parts of this comprehensive neuro assessment are done during your head-to-toe assessment. And what you will do is when you do a focused neuro assessment is pull those pieces of your head-to-toe assessment out. You're not going to check all 12 cranial nerves during a focused assessment. You're not going to check all 12 cranial nerves during your Q1 hour neuro checks. However, it is good to know what each function of those cranial nerves are so that you can look for deficits, especially if the MRI shows different problematic areas to different parts of the brain. So that is the importance of knowing your cranial nerves and knowing and understanding what your focused neuro assessment is and what it entails. So the motor system, I want you to make like your chicken, all right? Okay, so we're gonna check her strength. I'm gonna push down and you push up. Good, with your elbows. Use your elbows. Good, perfect. All right, and then the next one would be, go ahead and stand up for me, Kelly. Put your arms straight out. Turn your hands up. This is called pronator drift. Close your eyes. So she should be able to hold that for 30 seconds. What you're looking for is to see if one of the arms drifts. And if that does, that needs to be reassessed, okay? Perfect. So she does not have pronator drift. You can sit back down. All right, and then sensory system, which we won't be testing today, but that would be like the knee reflexes. Another thing you could do is take a cotton ball, have her close her eyes, and then touch her face with the cotton ball and see if she feels that, as well as a pinprick. Otherwise, that concludes our comprehensive neuro assessment, and I appreciate your attention.